Okay, uh, our next presenter is Hikmet. Hikmet is going to talk about the exploring AI applications in medical education for aspiring medical students. Hikmet is a junior student at the Passaic County Technical Institute. He's also trying to get in medical school. So he's learning a lot in the medical area right now. So Hikmet, it's yours.
Is this a clicker?
You can use this one. I will change it. Okay. Let me know when you need.
Hello everyone, I hope everyone is well. I first want to start my presentation by thanking the Society of North American Scholars for inviting me here and to present my research. So as Mr. Nedim stated, my topic is about exploring AI applications in medical education, specifically for medical aspiring students.
Interesting. Okay.
So my purpose for this presentation is to first give awareness to high school students about the benefits of AI. As you all know, AI is a rapidly developing technology, and I feel like it would be a missed opportunity for high schoolers if they would not invest and learn about the tool that AI can give to them in academic environments. And my second purpose is to challenge anti-AI perspectives in education. So some of the issues with the high school curriculum is, one, a generic curriculum. Now, high school curriculum usually has a standard educational system where it has a lack of personalization for specific students' needs and interests. It also has a restricted curriculum which has a lack of creative freedom and does not fit the academic level of all students. Another problem is a lack of support from teachers. As you all know, high school classes usually have 20 plus students to one teacher ratio. Now, one teacher cannot actively engage with the student one-on-one and cater to their interests and passions as well as they can with 20 other students. And my third issue in high school curriculum is a lack of critical thinking skills. Now, usually a high school curriculum involves memorizing a piece of topic, using that in a sentence and just throwing it out the window. Now, I feel like this is not a correct way to learn about certain topics, as it is abundance of memorization and not really understanding and applying the concepts. And it also has a lack of special education for students with disabilities. So what skills do physicians require? So first of all, for a physician to be an effective part of the medical industry, they need to be organized. Now, if a physician cannot actively maintain patient information, they cannot access that information in their medical research or to diagnose a patient. Another skill is to be knowledgeable in their expertise in their medical field. Now, physicians need to have a lot of knowledge in their field to be able to effectively diagnose and research their topic. And now I feel like the most important one is effectively communicating with patients. Now, in a clinical setting, communicating with the patient is very important as it allows you to extract valuable lifestyle information from the patient, which can help you diagnose any disease or disorder that the patient might have. And my final one is to practice their skills constantly. As new research is constantly being made, the physicians need to be updated in order to provide the best quality of care to their patients. And some benefits of AI to students is simulate patient instructions. Now, the School of Medicine at the Western Michigan University created a simulation center that imitates patient meetings using chatbots. Now, as I mentioned in the previous slide, communication is a key component of being a physician. So if medical students and high school students can practice the skill, this will effectively better prepare them to integrate into the medical industry. And then we have intelligent tutoring systems. Now, with the lack of available teacher support because of the large number of students in classes, this tutoring system can mimic one-to-one human tutoring and allow students to better understand the concept outside of school hours. And then we have adaptive learning systems, which personalizes the curriculum to one specific student, such as visual aid or hearing learning experience. And you can appropriately space and sequence the learning events, followed by specific remedial measures, such as assessments. And then we have virtual teaching systems, which is more of like a supplement to teachers and can help them to grade and to summarize medical literature to better help students to quickly analyze article. Go to the next one. So some pros and cons of specific AI programs is first in ChatGPT. So the words highlighted in green show the pros of an AI and the red highlight the cons. ChatGPT is a very natural conversationalist, and you can talk to humans one-on-one. And it also has contextual awareness. It is also very easy to access for students, as I even use ChatGPT to create this presentation. However, ChatGPT is prone to error and potential bias as it takes its information from the internet. And IBM Watson is a powerful data analysis tool, which is more of a virtual teaching assistant and can analyze a large number of statistics and easily graph them into pie charts or bar graphs. However, it has a high use cost and is not very good at limited general conversations. Google Gemini has more accurate data and is fully integrated into Google, which will give you more accurate data. However, this is prone to privacy issues and is less humanistic and creative, as it is more robotic and takes its information directly from the internet. And then we have Jasper, which is more of like a social media creation tool, and it can be used to create advertisements for different medical awareness flyers. However, it has a subscription and is reliant on detailed prompts from the user. And then we have Replica, which is more of like a mental health awareness AI and can help more high school students or those suffering from depression to improve their mental health. However, it is only useful for conversation and it has some privacy issues. And Microsoft Azure is an AI that can train AI, that can train other AI. It is also cross-platform and has Microsoft data encryption, which means your data is more secure while using Microsoft Azure. However, it requires significant technical expertise and is less human. So this is a bar graph detailing the relevance AI in past articles. An article conducted an integrative review in support of AI in medical education, and they have identified 37 articles based on the databases listed above, such as Medline, ERIC, Education Source, and Web of Science. Now, as you can see, the largest category we have is undergraduates, which shows out of the 37 articles, most of the articles have a target audience of undergraduates. Now, if we were to extrapolate the data, we could assume that in high school, this number would increase. And this is just another survey that has been conducted on 352 medical students, asking them about if they have received training in artificial intelligence. Now, in chart A, you can see 16% replied yes. And out of those 16%, you can see in chart B, 67% had to have training in artificial intelligence, to pass or gain their medical degree. And chart C highlights how a majority showed answered the survey of AI being beneficial to them in their training. Now this shows that AI can be very helpful for high school students and for undergraduates. And now, of course, with AI, there is always some cons and there is always some regulation that must be maintained. So some ethical challenges of AI include academic integrity. Many students can use AI to plagiarize and over-rely on AI for assignments and not use their actual critical thinking abilities to improve their learning and understanding. And then there could be misinformation and bias in the AI, which is a result of algorithmic bias, where the manufacturer specifically targets one data set and leads to inaccurate data. And then there's the issue of the intellectual property of AI. Who owns the actual content that AI is generated with? And this is a problem that needs to be addressed in the near future. Thank you. Does anyone have any questions? Yes?
This was a nice presentation, but this might also research topic. So if you go to a slide where you compare all the different AI systems, plus and minuses. So here, yeah. So can you dive into the privacy issue for both people interviewing and do you know any, can you give some examples of one you can?
Now, see, for Google Gemini, since it's integrated into Google, it could use the prompts that you put into the AI and create advertisements, the actual Google web. So it can be used for advertising purposes.
But the others don't have privacy issues listed and only listed in Zoom. So that's the perspective I see. So another thing is, just curiosity, why did you list conversational only for Replica as a comms? Because that's a string, only in conversation.
Well, since this is directed towards students, and students have a wide array of uses for AI, only being used for conversation can sometimes limit what students can get from the AI. So I just wanted to put that there to make sure that students understand what they're getting from when they use Replica.
I have a question. So, is there a data that reflects that some of these AI is being used by the undergraduate students, college students, or in particular fields? Is there any such data that we can track? Like Replica is very popular among medical students, or IBM Watson is for finance students. Is there any type of data that presents?
Now, to my knowledge, I don't have any such.
So how does the students make their choice? Is it because they know ChatGPT more than the Jasper or Replica, or is it because they require subscription fees? Is it how it's being determined, the user?
So basically, what I would try to get at from this slide is, you could use ChatGPT as a sort of data collection tool. Or you could use IBM Watson to analyze statistics in like a lab report. So I just want to give different uses for the AI so that students could specifically choose which AI is most useful to them in their scenario.
But do you have a preference for, like you were talking about the medical education, right? There should be, because this is a competition, obviously, in the market. So if the schools or medical schools would love to adopt this, will there be one superior to the other in terms of they're mostly fit into their curriculum? And medical science is a totally different science than the other science. It's very human-based, human-driven.
So from my research, I believe ChatGPT is the most
one step ahead.
The one step ahead, as you know, it's like the first AI that was created and is the most developed AI out of all 6 of these. So I feel like that would be the best AI to be used in a medical scenario. Yeah.
Any other question, comment? Thank you, Hikmet. It was a great presentation.